Awesome. Most of you who've just come off of the Thanksgiving here in Canada, happy Thanksgiving. If you're in the US, of course, happy Thanksgiving. That's around the corner. And we are here every Tuesday, whether rain, snow, on vacation, traveling, family emergency, we are here because we want to continue to add value to you. And as we go about our daily activities, I want to reintroduce myself. Not daily activities, our information here in the Health Talk. I would like to reintroduce myself. My name is Kerry-Ann Joseph-McLean. For those of you who are here for the first time on the platform, welcome. Those who have committed the time to come every Tuesday, we want to thank you as well. We do appreciate you because we get valuable feedback from you, tips, topics, questions, which is all great. And I actually love it because it shows that we're adding value and then we can continue to pour into you as we are learning as well. All right. Because as we learn, we learn. So I actually appreciate that. So just to let you know, my husband and I, Kerry-Ann, we are health enthusiasts. We are not health practitioners. We don't profess to be, but we are passionate about health, just like you, just like your family. We're moving towards being more proactive with our health. And in different seasons and time, it happens where we sometimes fall off the wagon with our health. But the thing is to get back up and to reinvent yourself when it comes to your health. So today, as we speak on a specific topic, which was brought to us by one of our participants here, I just want to actually go through my slide so you can share it with you. I can share with you, sorry. So let me just do that now. Awesome. Now, if you can see my screen, I just realized I did something here. If you can see my screen, please let me know you can. Put a 2 in the chat, please. Let me know that you can actually see it. Awesome. All right, so we're speaking on gum disease. Now, I know that gum conditions, gum inflammation, different things are happening with individuals depending on what they're experiencing. But it's not just about gum disease. It's many different factors that can be a risk factor if you've been diagnosed with gum disease or you have inflamed gums. Not necessarily gum disease, but there's some things that are going on that you're not quite comfortable with because of the discomfort you're feeling in your mouth. And so there are many things that are associated with this that can actually be related, either because you've had the gum disease or you have these flare-ups in your mouth, the inflammation with your gums, or it's the reverse. You may have a health condition which triggers gum disease. So tonight we're going to speak on different topics, but mainly on a topic which is gum disease, but they're connected with or associated with other things like hyperpressure, diabetes, stroke, hypertension, even cancer. That's another thing as well. Many other things as well that can actually sort of bring within this time frame that we have. Doing all of this, I found some fascinating information. And of course, as Cornel mentioned before, we get the information from credible sites. So we have doctors who've written studies. There's testing that has been done for decades. And so I sort of go through different credible sites. And as I go through these slides, you'll be able to see some of the links if you want to have them individually to go to do further get more information, feel free to ask and we'll be able to share with you. And if we don't have the answer, we can direct you to the persons who are professionals in their field. So there's something called periodontitis, which is a gum disease, a complication that can happen over time. And it can be linked to you having a stroke because you've been diagnosed with this if untreated, or heart attack disease and so forth. So this is a chronic inflammatory disorder, which rears its ugly head when tissues surrounding the teeth become infected. So you may think you have puffy gums, red gums, things may happen. You think, okay, this is not quite right. What's going on? And then you may not be able to have the ability to go to the dentist right away. So there's small spaces between the teeth and the gum, trapping debris, spreading bacteria. We know we're supposed to floss and brush our teeth, but not always as effective, especially if you have an underlying condition like diabetes or heart disease or stroke, so forth. So the gum causes tissues and bones to deteriorate over time, more rapidly than an average cavity. So you may not even realize you have this inflammation, this issue, because it starts from the gum from within. So there's healthy gums, then there's gingivitis, and then there's periodontitis. So that's where the extreme is. So things like signs and symptoms of periodontitis include swollen, bleeding, or inflamed gums that are sore, very tender, especially when you're brushing. Small pockets around the teeth, very sensitive. An odor may happen when you have continuous bad breath. And just to keep as a sort of note, sometimes your bad breath doesn't come from your mouth. It can come from within, from your tummy, from your stomach all the way up to your mouth, and then you develop bad breath. So there's different ways, symptoms that might happen. But if you have these symptoms that are connected with swollen gums, bleeding gums, and so forth, know that there may be signs of gingivitis or periodontitis. So a loose or wobbly teeth can happen over time, and that's when you're like in the last stage of periodontitis because you may have healthy gums leading to gingivitis. Tenderness or pain when eating, sensitivity, so to speak, losing your tooth or teeth, thick yellow fluid or pus on the gum. We may have like an abscess or an infection. The teeth looking longer due to receding gums, which has happened in the past to many of us, including myself when I was younger. So there's ways you can actually speak with your dentist to be able to reverse those things, like for example, receding gum lines. So heart disease, respiratory disease, rheumatoid arthritis, stroke, Alzheimer's and dementia, even preterm birth with low birth weight, worsening diabetes, cancer, these actually a systemic impact of gum disease. So as I mentioned before, you may have had gum disease and it leads to other things that can trigger or the reverse. And so not only those things like I mentioned those before, but also chronic kidney disease, cognitive impairment, obesity, metabolic syndrome, cancer, right? And now there's a vascular disease that actually can actually affect the heart, can actually be impacted if you have chronic periodontitis. This is the gum disease I speak of. So without good periodontal health, you can have, you can't have good general health because everything is connected, everything's impacted. One thing starts not working correctly, you're out of balance, and it impacts the rest of your body, your brain, your skin, different things can happen. But in this case, as I mentioned before, these are like on the severe case when you've been diagnosed with periodontitis, so gum disease. One of the other things I want to mention to you is that sometimes when someone has a stroke, or you may have heart disease, this is the cause that can happen, the reverse that I mentioned. But paying attention to your gums, very important. Even if it's once or twice you go to have your cleaning and have them check your scaling. If you'll be able to do that if you have benefits or not. It's very important to have that checked, even if it's once a year you can go, just to make sure that nothing else is impacted that goes down a rabbit hole of illnesses. So in addition to what I mentioned before with gum disease, high blood pressure is an issue. So if you actually take a medication for high blood pressure, this can cause your a negative impact on your gums, your teeth, or the other way around. So in some cases, there's some studies, some research show that they're strongly linked. So for example, if you have bacterial infection, more often, more prone to that, those bacteria can travel through your bloodstream and infect other body parts. So once a part is the heart, basically because, it's these microbes can inflame the valves and vessels. As I mentioned, everything is connected, right? So should that happen, you should develop elevated high blood pressure or other disorders linked to heart disease, because again, it's connected. High blood pressure and oral health is super important to be mindful of. Now, if it's continually happening where you've been diagnosed with hypertension, your numbers are high, it's not controlled, high blood pressure, you can exacerbate the gum disease. And remember, I mentioned it can happen the opposite way too. So if you have high blood pressure, you can actually exacerbate your gum disease if you've been diagnosed, or you're just on, phase 1 to phase 2, which is gingivitis going on to periodontitis, or the opposite. All right, so you actually have gum disease and it triggers where the bacteria gets into other parts of your body. So a PubMed study I found is a link here you can actually refer to get more details on that. So the connection between high blood pressure and gum disease, few things like inflammation, chronic inflammation, infection, which is the bacteria from the gum, which release inflammatory chemicals into that increase the heart rate and blood pressure. oxidative stress. If you've heard me speak about oxidative stress in most of my previous health talks, people don't realize that oxidative stress can actually break down the body. So your body's not getting the right antioxidants into the body. And so this becomes the reverse. And so free radicals get into your system, into your bloodstream, and can cause adverse negative effects, impact on your body. So things like, inflammation, chronic inflammation can happen. And it's just not it's isolated to one area like your gums, it goes elsewhere. The shared risk factors, such as poor diet, can influence the systemic inflammation. So things that are high acidic, things that are not conducive to your oral health, can actually inflame your gums more, causing a negative effects in other parts of your body. So eating right and consuming the right things, not only for your overall well-being, but for your body itself, your digestive system, and the nutrients you need, but also paying attention to your gum health. Hypertension impacts one's health on the gums, meaning high blood pressure can cause changes in the microcirculation, leading to tissue. So tissue ischemia in the gum and creating conditions which worsen the gum disease instead of improving it. You have to be mindful of. So you're speaking to your doctor as well as your dentist. So your family doctor can check your overall mouth health, because they do that when you're doing your annual physical, but also your dentist can check other things by doing an in-depth investigation of what's happening with your mouth. So can dental problem cause high blood pressure and heart failure? It can. So here's some numbers here. So moderate to gum disease, roughly in North America, 22% increased risk of hypertension. So it means you're on the borderline of having hypertension, your numbers elevated, or if you are, predisposition to that, you're actually 22% more likely to get hypertension. Severe gum disease, I mentioned, like periodontitis, 49% increase of hypertension. So that's a huge jump right there. Tooth loss, 10 or more, higher likelihoods of hypertension, especially once you've gone to the next season of your life, let's say 65 or over. So again, pay attention to all of that, plus other things, other factors as well. So the link between the hypertension, there's an increased risk, as we mentioned before, because you have gum disease or may have gum disease, or there's like just the borderline of that, and there's your higher risk of hypertension, it increases your risk of heart attack and stroke. So this gum disease or periodontitis is a common condition that increases the risk of all of these. And here's another link as well that I share with you. This is through the PubMed library, PMC and PubMed as well. And these are all documented by peer-to-peer and all the studies I've done. But keep in mind as well, having a healthy lifestyle, changing that, including healthy diet and regular exercise. If you follow those things, you can actually reverse some of the symptoms you have been diagnosed with if you're not to the latter stage where you're losing your teeth, so to speak. But there's always a way to be able to improve your health. So as I mentioned before, hypertension, high blood pressure, there's also a link between diabetes and periodontal disease. So I mentioned before, it will travel, the bacteria will travel to the blood vessels, blood streams, and impact your organs. And in this case, your diabetes numbers may be triggered, meaning your insulin, your pancreas, all of this can be impacted depending on how you take care of your gum health. So the wider link between heart disease is also a real risk. You're at risk. So although there's some researchers who were surprised to discover this, the periodontitis, if you've been diagnosed with that or gum disease, it hinders your blood pressure medication. So keep in mind, if you're taking blood pressure medication and you've been diagnosed with a gum disease or periodontitis, speak to your family doctor, let them know that you have this condition so that to make sure that you're monitoring your blood pressure to make sure that it's actually not inhibiting it. So it's not just about oral hygiene, but also making sure that you're protecting your heart for your to make sure you're not triggering a cardiovascular disease episode, because you don't want to impact any other parts of your body if you've never been diagnosed with a heart condition. Bacteria in the mouth, gum disease, as I mentioned, travels to the rest of the body via the blood vessels. This is where you get the inflammation. damaging the arteries, the heart, the brain, the liver, and organs. So there's actually a study, multiple studies on periodontitis and the link to all other types of conditions I mentioned before. So the bacteria, as I said, is not isolated to one area. So once the bacteria enters into the circulatory system, it activates a whole plethora of inflammatory responses, exasperating all of that, maturing more, multiplying, and you actually have a higher risk of cardiovascular disease. So be mindful of that. Keep in mind you can have a diabetic related stroke. You can have a heart attack if you've been had a stroke from because you've had diabetic related stroke. So everything is connected. And so gum disease from that to maybe if you've been diagnosed with diabetes or stroke to maybe possibly a heart attack. And this is why they monitor all of these things if you've been diagnosed with one of those conditions. So gum disease and diabetes, to mention, is a high risk of developing, those who have diabetes have a high risk of developing gum disease. Being mindful of that. So if you're caring for someone, an elderly person, and they haven't been going to the doctor, the dentist as frequent, encourage them to go or even take them, book an appointment to make sure that you eliminate all of those things. Especially if they wear dentures, they may not be aware that their gums are inflamed. They may see they have some tightness in the dentures or it's puffy, and they may express to you what they're feeling, especially if they're older, tend to keep things with them. Sort of investigate to make sure that they don't have an inflamed gums, especially if they're wearing full dentures. All right, so gum disease can causes gums to become inflamed, as I mentioned. But if you're diabetic, it's harder to manage. That's why you have to be on top of it. Here's another source I found through cdc.gov about diabetes and the complications with oral health. So gum disease and diabetes is a two-way street. So for those who are diabetic, 2 to 4 times more susceptible to this condition because they have poor blood glucose control. So the spike in their numbers may increase more frequent than we would like to. So that gives them a higher risk of gum disease. If you're looking at infections, again, they're a higher risk of that, especially if they're insulin resistant and their hypoglycemia, it's an excess, so to speak. It's too high. The gum disease can increase the blood glucose level, contributing to increased periods of time with high blood sugar, which triggers also inflammation in the body from the gums. And all of that, again, is a two-way street communication of poor oral health. And so as we, before actually, as I mentioned to you, if you're able to help the person who has diabetes to monitor their numbers, or if you are diabetic as well, be vigilant on your gum health as well. So for someone to say, okay, I don't floss that often, and then they have bleeding of the gums. Again, if you're diabetic, hypertension, all these things you have to be mindful of as well. So if you're clamping down on your food, you're chewing your food, you feel uncomfortable, there's persistent bad breath. I know sometimes as you get older, your sense of smell dampens. So if someone's around you that you trust, you can ask them just to know, just to see if I have bad breath or not. There's no shame in that. I do that all the time. When it's with one of my loved ones, and I say, is my breath sort of okay? I want to make sure that I'm presenting myself in a particular way when I speak to people. So there's no shame in that, okay? So if you have extremely dry mouth, especially if you're diabetic, you can feel very thirsty more often than normal, and you may have excessively dry mouth, which sort of is an indicator that your oral health is not to its optimal best. Poor or slow healing and happens if you're diabetic as well. So if you find your gums are bleeding or you have a sore or some sort of infection in the mouth and you're not taking things like antibiotics or something's not working quite well with your medication, you may have a slower rate of healing within your mouth for your oral health. You may develop thrush. And so this thrush is like an infection in the mouth. What happens in the tongue, the roof of your mouth, maybe your gums. So pay attention to that as well. It doesn't matter what age you are, from a baby to an adult to senior. Pay attention to that as well. There's actually a study here in Canada in one of the universities that said there may be a link between vitamin D, gum health, and diabetes. We know that the vitamin D3 is really good to consume for overall well-being, especially if you are like myself, your melatonin is on the darker side than our counterparts. Vitamin D is very important and it's also very good for health, your overall health. If you are finding you're deficient in vitamin D, speak to your doctor, maybe a naturopathic doctor, see what you should take. I normally take about 3 to 4,000 in international units because I am vitamin D deficient at one point I was. So I'm back up with my numbers, of course. But, gum health is so important for that. So for diabetes as well, we have to ask ourselves, how is gum disease connected to diabetes? Well, of course, exercise, what you eat, how you sleep, on your oral hygiene, many other things come into place, but it's a balancing act. So there's a study was done actually that the percentage of people who through the American Diabetes Association that living with diabetes and watching what you eat, how your gums, your gum health, your teeth, all of that, there's actually higher risk, as I mentioned before. So if you look at the numbers here, you can actually see in America alone, and it also can be indicated for Canada as well. But nearly 26 million Americans, that's 8% of the population, live with diabetes. So imagine the percentage that may have a gum disease gingivitis, especially if they're not able to afford going to a doctor or a dentist to see about their gum health as well. So even if it's once a year, I want to encourage those in your circle, in your community, to be able to go out and just to check that for their overall health. Actually, there's a connection in one of the studies I found that gum disease is connected to heart disease and stroke. Some further information here is something called ischemic stroke. It's a specific stroke. It's caused by a blocked blood vessel that delivers blood to the brain. So the link between the gum disease and stroke is the inflammation, which is present for both. So brain is inflamed, the gums are inflamed, and so it hardens the arteries that results in this triggering of this type of stroke. Again, stroke comes upon us and it's like, now, for now, there's very few signals that are long term. But if you're diabetic, your numbers are up, you have a higher risk of getting a stroke or heart condition where you have a underlying heart cardiovascular issue, maybe not disease, but a cardiovascular issue that you've been diagnosed with. Again, pay attention to your gums. They are connected. As I mentioned, the study that I was reading on, because you may have periodontitis and you've had someone who had a severe stroke, means that this person may be over 60, maybe younger. They have a higher risk, and of course, it's more severe in the periodontitis, especially for men who are this particular age. The study also confirmed that those with the gum disease have nearly double the risk of suffering a stroke if you've not had a stroke before. So if you had the gum disease, periodontitis, you have a higher risk, double the risk of those who have healthy gums. Again, is super important. Things we take for granted, right? There's also a link between the stroke and heart disease. So the connection between the gum and the heart's health stems from the inflammatory response on what's happening with your internal system. So bacteria from infected gums can enter the bloodstream, causing the systemic inflammation. So it contributes to, again, hardening of the arteries, not only the brain, but also to your heart. And the studies found that the individuals with this gum disease are more likely to suffer from a heart attack, heart-related issue. So making oral health as an essential part is so important as well. So gum disease and heart disease, this additional research that shows that inflammation in the body caused by the gum disease precedes a major cardiac event such as a heart attack. So this would be an underlying silent and trigger that you're not mindful of that can trigger a major event like a cardiovascular attack. Another reason may be that bacteria from the gum, of course, as we said, travels to the bloodstream to the heart. This infects the heart valve. Again, be mindful because it's a two-way communication. I found this through Harvard published article. So there's also connection to osteoporosis. So not just only the the brain, the mouth, the heart, diabetes, but also osteoporosis, which is connected to gum disease. There's a medical disease, you know, as osteoporosis over time, where the bones become brittle and fragile. Could happen. You may have had a cancer scare where you've had to do radiation or chemo, impacting your bodies or your bones, or you may be going through the season of life through menopause or andropause, we call it for men. This actually can cause your bones to become fragile and brittle if you're not doing the right things to strengthen your bones. We know that vitamin D, vitamin C deficiency has a negative impact on this, especially as you age. Again, their studies found that a gum disease is also a risk factor. So again, making sure that your body is in a homeostasis state, meaning well balanced, right? Or overall well-being. So the inflammation is the underlying condition, underlying impact on you because it's about inflammation doesn't stay isolated to one place. So the gum disease also impacts not just, as I mentioned before, it impacts the whole body, right? So it's connected also to respiratory illness or respiratory disease. The gum disease can impact your lungs, making existing lung problems worse, exacerbated. So, for example, you've had, let's say, you know, the flu or COVID, or you may have had pneumonia or something impacting your respiratory. You may have, you know, been in an environment where you're sort of exposed to toxins impacting your lung capacity, your lung health. And so you have compound that with a gum disease, it makes it like a double, and it heightens the risk of you having further respiratory issues with your lungs. So the bacteria is inhaled, absorbed through the lungs through tiny saliva droplets. So once the bacteria reaches the lungs, an infection can occur, especially when the organs have previous damage. If there's underlying damage, and of course we know that there's a higher risk. So periodontal disease is also linked, has been known to be linked to COVID-19. There's some studies that were done that I found that I mentioned before COVID, those who had severe gum disease are more likely to have a serious complication from COVID-19 because there's an underlying condition, right? So those who had the need for a ventilator or had an increased risk of dying from the virus, the immune system's down, inflammation's up, gum disease is something that's impacting them. They have other underlying conditions. So this is like, it's not just attacking you because you've had COVID, but also the whole body as well. Also, there's different types of cancer that can be triggered from having gum disease because over time it develops not just for gum disease, but beyond that. So those who have been diagnosed or identified as having gum disease, there's a higher risk of developing certain types of cancer, especially cancer of the stomach and esophagus. Of course, the pathway, you know, the bacteria is traveling, you're developing, you know, not just the gum disease, but also the risk of cancer because we all have cancer cells. Some are dormant, some are not, and depending on what you're eating, how you're sleeping, what you're doing, what you're thinking, and of course, how you take care of your gum health. So according to the study from Harvard University, the bacteria from gum disease can negatively impact the gut health. I talked about gut health in a previous health talk, and sometimes we don't realize that the gut is impacted because it's something that, you know, we don't quite focus on too much, right? Because we're thinking of overall health, especially if you have an underlying condition like diabetes or high blood pressure, hypertension, and so forth. So the observational study found that people with gum disease are 43% more likely to develop esophageal cancer and 50% are more likely to develop stomach cancer. That means the higher risk for those who have, compared to those who have healthy gums. The gum disease and oral cancer, you may have pain, not realizing you actually have, you know, the risk of oral cancer. To someone I know who had cancer of the tongue. And so all of his sensitivity, everything is now gone. Eating what she has to eat is totally changed her life. Now, did she have periodontitis? I don't know, but she had cancer of the tongue and the throat. So the gum cancer symptoms may include things like pain, from, you know, basically low pain levels to intense. Ulcers or sores can happen at the latter stage because that's manifesting on the outside of the gum, swollen lymph nodes, and teeth loosening, as we mentioned before. So it's important while gum disease or periodontal disease do not cause oral cancer of any kind, according to the studies, but making sure that your overall oral condition is actually being cared for so you don't increase further risk. Pancreatic cancer actually has, from one other study, shown that it could be linked with gum disease. Pancreatic cancer is believed to have a direct connection with the diagnosis of gum disease. So basically, the bacteria of your mouth can lead to the inflammation that I mentioned before, far beyond gingivitis and cavities. So another study showed that over 361 participants who later developed pancreatic cancer, with these samples from the participants who did not develop the condition. It showed that they found that the participant with this level porphyromonas gingivitis, sorry, tongue twister here, had a 59% increase in the risk of developing pancreatic cancer. So the higher levels of this particular bacteria cause the increased risk for developing pancreatic cancer. So again, my mother died from pancreatic cancer. There were no underlying conditions until the latter stage. So again, it's very hard to predict. She was diabetic and she had diabetic-related stroke. And again, these were things, once she's passed, that we found out were things we should have looked out for. So I'm just stressing this to you as trying to be proactive with other people that we love, that we want to be able to share this information with. So there's also a link between menopause and gum disease, which is a periodontitis. So some of the common perimenopause mouth problems would be shifting of the teeth, dry mouth, bad breath. There's something called burning mouth syndrome, tooth sensitivity, bleeding gums, oral thrush, and mouth sores. This can actually happen if you're going through the menopausal or premenopausal stage or season in your life. So those who have gum or periodontal disease is at a higher risk factor for cancer of the breast, oral, and esophagus. So women with gum disease were 3 times more likely to develop cancer. So again, gum health. So gum disease was associated with this increased risk of cancer. For post-menopausal women, so they've gone through this perimenopausal, menopause, now post. So of course, a lot of things that are happening, estrogen level, hormone change, all of this happens. And of course, it impacts not just your physical body from the inside and out, from the skin and other parts of your body, but also your gums. So the postmenopausal women with gum disease, as we mentioned, have a high risk of developing several types of cancer. One in particular is, especially for women who've never smoked, is the risk of gallbladder and esophageal cancer. So these were higher amount of post-menopausal women with a history of gum disease versus those who didn't have gum disease, who have healthier gums. Healthy gums drastically reduce risk for stroke and Alzheimer's as well. There's a study for dementia, Alzheimer's, and gum disease. Alzheimer's disease, there's a study that shows a connection between bacteria association with periodontal disease and the progression of Alzheimer's disease. As I mentioned before, a lot of individuals who are older who have been diagnosed with Alzheimer's, many wear dentures, sometimes the gums are not checked, the health gum, the oral health is not checked as frequently, so there's a higher risk of someone getting the gum disease. And of course, this could be part of their Alzheimer's, the progressive or aggressive stage of the Alzheimer's. So gum disease bacteria, again, will travel to the brain, contribute to the development of Alzheimer's. It's not the only thing, but again, it's one of the contributing factors for that. So how does gum disease impact Alzheimer's? Well, the mouth is home to around 700 species of bacteria. I know, it's a lot. So many are harmless. For the harmful ones is the one I mentioned before, which is the bacteria that can actually thrive when proper oral hygiene isn't maintained. The bacteria produce toxins and inflammatory molecules that can enter the bloodstream, reaching distant organs such as the brain. Once in the brain, these inflammatory markers may contribute to a cascade of events, so exacerbating cognitive decline. So for instance, you have chronic inflammation can cause neurons, a defining characteristics of the Alzheimer's, and not just Alzheimer's as well, but dementia and any other brain condition that you've been diagnosed with or you've heard of someone being diagnosed with. In your case, I pray this is not the case, but I'm just sharing this information with you. The gum disease leads to the increased presence of harmful bacteria in the mouth. So when these harmful builds up, it can actually be ingested and travel to the stomach. Here we speak about the esophagus as also your stomach of the type of cancer that can happen. So once there, the bacteria can cause inflammation to develop in the balance of your gut health is sort of like disrupted. So when we're going through the taking care of your overall oral health, of course, make sure you check with your doctor for your overall well-being for the other areas of your body, especially your stomach, your organs, your bloodstream, and so forth. So while the stomach usually resists the buildup of foreign bacteria, the harmful oral bacteria has the ability to disrupt the healthy stomach bacteria because we have healthy gut bacteria and harmful gut bacteria. So we need, if there's other balance, is what happens with the your balance of your, we call it the homeostasis stage. So what happens? Basically, your the resistance to disease that's caused by the bacteria, it actually weakens the ability. So meaning that, if it originates from the mouth, it's traveling at its own pace, by that time you don't realize that your gut health or the imbalance in your gut is connected to your gum health or your oral health. Another thing to be mindful of is if you're a smoker or you're thinking of quitting, either reducing the amount of time you smoke, even vapors as well, drinking less, because these things dry out your mouth, which stain the teeth, causing bacteria to stick around, right? So this increases your risk of developing gum disease and oral cancer. Heavy drinkers are in the same boat. If you're a drinker, okay, again, it's moderate as best as we can, or no drink at all, no drinking alcohol at all. But of course, that's your personal choice. Heavy drinkers are in the same boat. So basically, this is a result of high levels of plaque lingering on the teeth, giving more breeding ground for bad bacteria. The foods that can benefit your teeth and overall health can range anywhere from, the right types of cheese, nuts, sweet potatoes, which I actually love, green leafy vegetables, yogurt, the right kind. For example, Greek yogurt, which is very healthy. Look out for the yogurts that are heavily mixed with sugar. Or cornstarch, so be mindful of that as well. The right kinds of teas, garlic, cloves, citrus fruits. If you have rheumatoid arthritis or enterocolitis, we would say lessen the amount of citrus fruits that you consume because that can actually inflame your body. Consuming the water throughout the day, dark chocolate, the right kind, not the ones full of sugar. Fish that are wild caught, not farm grown. Carrots and other types of vegetables as well. Other types of food that can help you with preventing decay. If you're able to get food that are rich in probiotics, like sour pickles, fermented olives, sauerkraut, kimchi, yogurt, as I mentioned, kefir, sourdough bread, even miso, enhanced milk, and so forth. So there's quite a bit of range of foods you can play around with that'll help you with your overall oral health. Foods that are very rich in vitamin C, D, calcium, fluoride, like in fish, the right kind of fish, phosphorus, vitamin A, very good to have with your overall healthy gums and teeth. Things that are helping you with anti-inflammatory properties that you're consuming. If you're able to, the quantity of time that you can do it, 3 to 4 times a week if you can, making sure again it is wild grown, not farm grown, because some fish are heavy in lead if it's farm grown and antibiotics. So very careful of that, especially your meats or your dairy or your eggs and so forth. So make sure everything it is as best free of those agents. The amount of green leafy greens, 2 to 3 cups a day if you're able to. Mix it up a bit with colorful vegetables. Consuming food like turmeric, ginger, garlic, at least be liberal with those if you're able to. Healthy fats, so stay away from seed oils. Seed oils are not good for your body. Healthy fats like olive oil, avocado oil, avocados, nuts, in moderation as well. Again, knowing that your diet impacts your overall health. I love eggs. Of course, you may not, but again, eating, foods that are high levels of vitamin K2 helps. So it helps strengthen your teeth, your gums, and your cardiovascular system. Grass-fed dairy, if you're able to. Kimchi, and I mentioned other things as well, and as the list goes on and on. But these are some of the ideas you can get as to the types of food to give you the right nutrients you need for your body, your gums, your teeth. Leafy vegetables, I mentioned, it depends on what's in season, but also you can take supplements that are rich in nutrients, fibers, and so forth. Consider also superfoods. There's different types of superfoods. I mentioned like turmeric, ginger, these are all superfoods, right? I love blueberries, you may not. Some people may love ginger, pumpkin seeds. All of these things are really good superfoods. They have a right amount of uh, antioxidants per serving. May not be sufficient for you depending on what you're experiencing, but you want to get the most amount of antioxidants, minerals, vitamins, and nutrients that you can from your daily consumption. We know that most foods are depleted in nutrients because of the soil, but there are also things you can do to add or to stack on what you're eating that'll help you with ramping up your nutrients what you need for your body, the vitamins. I love spirulina. You may not love me not, but I actually mix it with mango with a smoothie. Because spirulina can be a bit strong for some. You have quinoa, all sorts of things you can actually consume. But the superfoods that I actually really have fallen in love with, it's three of the great sort of combination of nutrients and of a medicinal. So consider food supplement as well as combined with nutrients. If you're looking at something that can provide medicinal and nutrients in one, that actually is a win-win. So there's different types of superfoods on the market. There's spirulina, which I actually love, aloe vera, hemp seed. You have a plethora of different types of superfoods. They all have their benefits. But in all the research I've done, there's over 3,000 case studies through Public Medical Library, which is not part of who we represent, but I go there for factual information that have been documented and proven. And reishi is actually on all the hierarchy of food, supplement, and medicinal supplement in the way of a superfood is number one on the planet. And there's no known negative interaction with other medication thus far. So there's three I mentioned to you, which is Ganadin, which I fell in love with about 14 years ago. I've been consuming with my family for that length of time. Many benefits on my part I've noticed, observed about myself. But also there's two more, which is called cordyceps and lion's mane. And lion's mane is new to my world about almost 3 years ago, and I'm actually noticing that as well, which I'll share with you some of the things. The supplements, as you're looking at in the way of nutrients, is thinking of comparing it. If let's say you're eating avocados or teas or broccolis, things like that, you need to consume, X amount to get the nutritional value of just having one dose of the mushroom or reishi, we call it. Gives you over 150 antioxidants versus, let's say, the green tea. You may need about 3 to 4 cups to get the equivalent of what you need. You need to have about 7 heads of broccoli to get the amount of more than 7 actually, 150 versus the 7 per broccoli head in the way of antioxidants. We need antioxidants, terpenoids, flavonoids. These are all things we need in our body because we're consuming the food, but we may not get the right amount. So anything from being antibacterial, antiviral, anti-inflammatory, neuroprotective, all these have benefits of the foods we're eating. We're not getting the right nutrients. So think of it this way. If you were to add to what you're consuming for your energy, and you consume something that has the infusion of this superfood, you can actually help with your oral inflammation, reducing the inflammation in your gum. You can actually have your overall body may be highly inflamed to reduce inflammation in your body, especially if you have rheumatoid arthritis or any type of inflammatory disorder. It actually helps with, many of the things, but not just nutrients alone. the fact that it is anti-inflammatory, anti-cancer, it helps with nerve regeneration. It helps with impairment of your cognitive. I mentioned before that gum disease can then impact your brain for Alzheimer's and dementia and other brain disorders. It actually improves cognition and helps alleviate neuronal damages in the brain. So basically neuroprotection. It actually helps to get your body free of free radicals, eliminate that. It's meaning that your body will get the right antioxidant to be able to release the oxidative stress from your body, which can lead to free radicals. So it does the reverse. So it's very high in antioxidants, very high in some type of nutrients like isoflavonoids and flavonoids itself. We know we have vitamin C, D, E in most of the foods we eat. Same thing with this, but a higher dosage. It is also considered anti-cancer, as I mentioned before. So it helps to support the body, protect the organs, protect the bloodstream, protect the gut. It helps with preventing cancer. So this is cancer protective effects of this type of mushroom. Not only that as well, for those who are diabetic, it has anti-diabetic effects on the body. Works like if you're taking things like metformin or Janumet, the properties are similar, but this one is a natural nutrients that you're consuming. Again, like for my mother who was diabetic, I actually was able to consume both, and at one time she was able to get off of her medication. But again, it works on a person to person's body, what they're consuming, how they're eating, how they're moving, and so forth. But in this case, we know with the gum disease, with the diabetes, it works as an anti-diabetic, but also it helps improve your glucose metabolism. It helps with decreasing your blood glucose and reducing body weight over time, maintaining that. And also, for those who have inflammaging and oxidative stress due to diabetes, it actually reverses that or alleviates it. And it has many other properties, including for those who've had issues with cardiovascular disease. It actually helps to alleviate or to reduce or minimize some of the symptoms of a heart disease because of the oxidative stress being released from the body. But also has antioxidants, a high amount of antioxidant properties. It also has been known for those who have suffered or suffering with Alzheimer's disease or Parkinson's disease or stroke. It actually helps to reduce the symptoms or even alleviate some of the symptoms of what you're having if you have a diagnosis of a condition. Now, these are not my sayings. These are coming from PubMed.gov, and these are the PubMed IDs. You can take your time and go through, capture the ID, go into those websites, do your research, and there's a whole bunch of information, much more than what I'm sharing with you. In addition to that, the Alzheimer's disease, because the body's getting sufficient amount of antioxidants, helps with nerve regeneration, helps with the protection of the brain, neuroprotection. It helps with improving cognition. It actually supports the body to have a more overall well-being, including the brain. Osteoporosis, as I mentioned before, is something that you can develop from gum disease and other conditions that you're going through that triggers the osteoporosis process. It actually acts as an osteoprotective effect. It has that effect to alleviate or reverse with anti-inflammatory properties. It exerts protective effects on the bones and the articular cartilage, meaning it protects your bone health, including your overall well-being. Not only that, it's for individuals who have been diagnosed with premenopause, postmenopause, because of the gums, you've had some sort of low, you're dropping your estrogen, all of these things can impact your bone density. If you are not taking the right amount of supplements, like vitamin D and vitamin C, then you know that you're at higher risk, right? So if your body can absorb it, that actually can help to absorb it better, but also it improves it. So cordyceps and the reishi helps to improve the bone stability. And the reason I say that, like my cousin who had stage 1 breast cancer, she did her test for her bone density before her radiation and after, and actually it improved. And they were asking her what she was doing, and she's 9 years older than I am. So in this case, it helps in improving with my family. Your body is different than mine. So of course, as you consume it, you'll be able to tell through all the different tests that you may be doing. We know that osteoporosis is a silent disease, so we may not know until something breaks that you may be at high risk of brittle bones. Again, being proactive is very important. And as you're going through your seasons of life, making sure you're taking the right nutrients, this could be a great addition to what you're consuming or to replace what you have. Things like calcium, magnesium, and phosphorus are very important. So if you're taking this reishi, it actually helps to absorb certain nutrients into your body more effectively into the intestine, meaning that it will help your body to get what it needs in the way of nutrients. In the way of the different types of minerals you need and polysaccharides and all these nutrients, we know that the Ganoderma helps to alleviate oxidative stress. And you need to Google oxidative stress to know exactly what that means. It's a term that we're familiar with in hearing it, but do your own diligence and see what that does and how it impacts your body with the free radicals. It also possesses many other things, but also helps with main thing is inflammation, but also oxidative stress, as I mentioned before. Not only is that the cordyceps helps with the brain and gut in the way of the brain gut axis. So from the brain and the gut, they're connected. They're like the second brain is your gut. You have your first brain and second brain. So if they don't communicate effectively, that's where disease happens. And if the gum disease impacts the brain, then the brain can't communicate effectively to the gut. So that's basically how it's connected. So you're consuming something that has, the right amount of nutrients you need. It can be work by itself or synergistically with the reishi. And also we know that the cordyceps itself has a prebiotic component that reduces the side effects of some treatments that you may be going through, especially if you have a gut health issue, like leaky gut syndrome, for example. And as we go through all of these, keep in mind that if you can manage your oxidative stress, which just doesn't just stay isolated in one place, it can go to your brain, your body, overall health. And if you're impacting from the cellular level, where your brain is, your cells are actually being attacked by free radicals, and then you have a breakdown because of oxidative stress, it starts maybe from the gums. I mentioned the brain to the body, but especially your cell, the health of your cell is impacted. So we're talking from the cellular level itself. The cordyceps as well is also helps in many other things, especially in people who have osteoporosis, symptoms of that, but also can help to prevent oxidative stress, as I mentioned before with the reishi. It has many health benefits, including supporting your immune system, your memory, and many other things as well. So we're speaking more on the information side. That's what we're focusing on, especially from the point of view from the gut oral health. Cognition is very important for us to be able to know that we're consuming something. So the lion's mane helps with properties such as, and it has properties, anti-cancer properties, it helps with the immune system, it's actually considered anti-dementia. Anti-Alzheimer's helps with the brain and the gut, supports the cognition function, but also mental health, mental clarity. I think things like this can impact you, especially if you've been diagnosed with a condition like that. So this is where we are so excited, although I've shared this information with you. We are part of a brand that with a purpose, we help people create better and healthier lives. And so we have been able to offer this particular superfood in the way of everyday consumable items like coffee, tea, hot cocoa, because normally this reishi is very bitter to taste on its own. As a tincture, very bitter. But we have a patent that actually eliminates the bitterness, but you still get the nutrients of that. So we represent a brand called Organo. And so we know that it supports the immune system and also helps to fight against infections and infectious disease. But it comes in forms like this. So especially for the oral health, I want to focus mostly on the toothpaste, which has the reishi infused into it. We have the coffees and the teas, the capsules, and so forth. So you're getting your daily dose, especially if you want a therapeutic dose. But ask yourself, how many times a day do you brush your teeth? 3 times, 2 times, some people 1 time. But if you can actually have oral health in the way of your toothpaste, that you're actually soothing your gums with helping it to be less inflamed. This is something I want to focus on today. So we know that again, the we supply is 100% certified organic, locally grown, on plum logs as nature intended to be. We have over 32 qualified certifications versus those who are grown in plastic bags, maybe at a lower cost. But again, the impact of nutrients you're getting into your body is vastly different as well. It's still considered certified organic, but it's not at the level as what we have in the way of quality. So it comes in the therapeutic dosage. It's called the mycelium, which is a rooting body. Sorry, the roots of the reishi. It's called mycelium, the fruiting body, which is most of these products that I mentioned before, the beverages, are in the fruiting body of that. This actual, to your left, you see the actual Ganoderma. That's the Ganoderma lucidum, the fruiting body. Then you have the spores, which are the seeds that go into the air, onto the palm logs, and to regenerate more reishi. And so this is how we are organically grown from as nature intended to be. So you can consider unlocking the full potential of what you can consume, getting the right amount. This is the focus I want to bring to your attention is the OG Smile, which we've been using for well over 14 years. This actually has no fluoride in it. So it's great for kids and kids at heart, like myself and you. And so imagine you having a toothpaste that can help with your gums from bacteria, decay, and other factors. For myself, since consuming this, I've had no cavity and I love a good chocolate. But I have not, I'm go to my dentist at least twice a year for my cleaning, and they have no cavities. And I used to have receding gums when I was in my 20s, going to my same dentist for the last 25 years, and no receding gums since I started consuming this. And this is just my testimony. It doesn't mean that is a fact for you, but I want to share that with you. So we have not only do we have the Ganoderma extract, it has bamboo charcoal, it has fresh mint peppermint, love the taste. Many other great ingredients in there. Again, the main thing, it is sulfate free and fluoride free. And this is where the reishi comes into that. So the benefits we think of is that it fights against bacteria, and that actually helps with your healing of your gums. And as you continue to do the right things to keep healthier gums, healthier teeth, this would be a great addition to you to have. And this actually lasts us very long, especially within my household. The Royale is one of the things I've fallen in love with. I actually have it here to consume. It has 3 mushroom. This one is on back order. I do have a couple, but this one will be one of my new favorites. It has the reishi, it has the Ganoderma, I mean the cordyceps, also the lion's mane, and you have 3 superfoods in one, and I actually can tell the difference right away. The reishi and of course it comes in the tea form, caffeine free. And also we have coffees of different kinds. I'm not sure if the free shipping is still on, but there's a promotion right now. If you were to get products from our website, especially if you were to give yourself a challenge of just trying for 30 days or 60 days or 90 days, just to see what it does for you, you actually can save on shipping and you get 10% off if you do it on the website. So as I wrap up here, I'd like to ask if you have any questions before we move forward. I'm just going to check the chat and see what it says here. Okay, no questions, but I just want to make an announcement. Thank you so much for your time. I do appreciate it. We do have Ask the Doctor with Dr. Bob Rakowski. He's one of my mentors. He's a naturopathic doctor and also a nutritionist, chiropractor, and a kinesiologist. They actually have Ask the Doctor once a month. Once a month, you can ask him anything. So he has, I'm going to share with you his link. If you're interested in joining, I will share that with you. It's tomorrow at 8 p.m. You can register for free. I'm going to add it here in the chat. You can grab it from the Zoom information I'm sharing here. And you're more than welcome to join us to be able to be a part of that and ask a question. So it's not showing me to, okay, it's not allowing me to copy it into the, it's not allowing me to copy it into the chat for some reason. Let me just make sure I do this. Actually, let me just first we do all of this. I'm just gonna end the call, end the recording right now, and then I'll share the link. But thank you so much for your time. I do appreciate it. As we wrap up this health talk, we're here every Tuesday night at 7 p.m. You can join us and we'll be able to provide you with valuable information. If there's a particular topic we haven't covered as yet, please feel free to recommend it. We did have actually Maria who talked about gum health, and I was able to provide information here. So thank you so much, Maria. I appreciate that. So I'm just actually going to stop the recording now.